I'm Dr. Ken Best, and thank you for watching this introductory video, which is important before we start the program. It's to give you an overview of how we got into this whole obesity epidemic in the United States in the first place. Here with the Ideal Weight Loss, we use the Ideal Protein Program because it works. Here you see a few clients who have had incredible amount of weight loss while using this program. The thing is, you really have to be dedicated to doing the program the way it's done so that you can effectively be a fat-burning machine. When you're cheating and not following the program, it makes it very difficult to do. What most of my clients say is that after the first month, they found in the beginning it was maybe a little rough for the first week, but then afterwards, once they got used to the program, that it's very doable and very easy, and it takes a lot of the work out of the weight loss because it's already done for you. And if you just follow the program, it's pretty simple. So I want to give you an overview of the obesity epidemic. 2 out of every 3 American adults are now overweight. That's also 1 in every 3 US children. That's becoming a real health issue and raising the cost of health care. It's also causing a problem called metabolic syndrome. Metabolic syndrome is a disease or a syndrome where there are 4 different aspects of it. If you have 2 of these aspects, it means you are predisposed to having metabolic syndrome. And those are abdominal obesity, which is greater than 40 inches for a man or greater than 35 inches for a woman, having high blood sugar, high blood pressure, or high cholesterol. And many people these days have at least 2 of these things going on with them. And this program can help you, if you really follow the program, change your physiology and change your life. This is the obesity trend in America from 1985 to 1990. And what we're seeing here in the dark blue is 10 to 14% of the population being overweight. And that's 30 pounds or greater overweight for a 5'4" person. And that's quite a bit of weight. I'm just going to click through very quickly, and you can see how the trend basically comes from the East Coast over to the West Coast. And now we're getting up to 15 to 20% of the population. And we'll go a little bit further, and now we're getting up to 25% of the population. So now we're up to 25 to 30% in the dark red zones. So you can see how quickly from 1999 to 2010, how quickly the United States has become obese. And the problem or the culprit is sugar. What most people don't realize is that 4 carbohydrates equal 1 teaspoon of sugar. So if you're having a piece of bread, for example, for breakfast, and let's say that's 28 carbs, so that would equal 7 teaspoons of sugar. And then you add that up with your orange juice and everything else, our body is metabolizing that much glucose or sugar. In 1905, we were eating 5 pounds of sugar a year. Guess how much in the year 2009 we were eating in sugar? You're going to be astounded, so guess high. 150 to 200 pounds. That's like my entire body weight in sugar that a person is eating a year. And your body is really not set up to handle that. Your pancreas that secretes insulin is being overworked. So what we're looking at is a modern day epidemic involving this syndrome X or metabolic syndrome. The syndrome X is a combination of the abdominal obesity, high cholesterol, high blood sugar, or high blood pressure. And the connection between these is insulin and this hyperproduction of insulin, which also then results in the cells of your body becoming insulin resistant. And this is what leads to things like diabetes and other problems in the body. So how do we store this fat and why do we get so fat? Well, first of all, we have developed such bad eating habits, eating very high glycemic index foods. The insulin causes us to store the fat. The dysfunction of the pancreas because it's being overworked from all the sugar. And the lack of exercise is predominant in our society. Insulin has 2 roles, 2 main roles. It's to lower the blood sugar, and it also stops the fat from being broken down. Think of it as locking the fat into the fat cell. So when you have a high glycemic or sugary meal, that's actually causing you to retain fat or hold on to fat because your blood already has too much sugar, so why break down fat for sugar? Think about it this way: is when we're looking for energy in the body, we have three sources of energy. And we're going to talk about it in terms of like banking. If you look at your glucose store, which is your sugar stores, your glycogen in your body, we look at that as your checking account. And then your muscles also can be converted or catabolized into energy as well. But we don't want to do that. We don't want to lose muscle. So think of that as a CD account, which you get penalized on. And then there's this big reserve, the fats in our body, which produce a lot of energy. But we never get into our savings until we've emptied out our checking. And then the next place we would naturally go is the muscles. So what we're doing in this program is we're providing you enough protein so that when you run out of sugar, because we're giving you very low sugar content foods, that you give you enough protein so we skip over and we maintain the lean muscle mass and we go into what we call a state of ketosis where we burn fat. So this is a fat burning protocol, and that's why it's so much different than just a low calorie diet. And that's the one thing that you need to keep in mind and realize on this program, is that it's a fat burning program. And if you just want to do a low calorie diet, this is not the program for you. It is low calorie, but we have to trick the body into burning fat. And once we're there, we want to stay in that mode. So it's not a good program for people who are going to cheat. So to be honest, you really have to make a commitment to this program to make it work for you. So are you really willing to stick to the program to make it work for you? The typical diet, which I was talking about, the low calorie diet, you lose water, you lose fat, and you lose lean, soft tissue mass. So those common diets that are out there, when you've lost the weight the first time, the diet works pretty well for you, and you've lost a substantial amount of weight. But now when you regain the weight, you don't regain the muscle, so actually now you've become fatter. You've actually become more unhealthy. And now when you try to go back to that diet and try it again, it becomes a little more difficult. You may lose weight half as quickly. And then you regain the weight again. So you become even more unhealthy and fatter again. So the third time you go back to one of those low-calorie diets that are very popular, it's so difficult to lose weight. It's not coming off. Now your metabolism is lower, and it makes it much more difficult for you to lose weight. So the answer is using the ideal weight loss and the protein products to get your body into a fat burning mode. So just a quick overview. So your normal diet, let's say it's a 2,200 calorie diet for like a 5'5" person. They're going to have a certain ratio of carbs, fats, and protein, which is a normal balanced diet. Then on a typical low calorie diet, they just kind of squish everything. So they lower your amount of carbs, your amount of fat, but they also lower your amount of protein. With the ideal weight loss, we're using these ideal protein products so that we're giving you an adequate amount of protein so that your protein levels are about the same as when you're not on a diet. So we keep the muscles healthy while losing fat. So we want to reduce the calories. We maintain the vitamins and minerals and potassium and other electrolytes, so we're giving you vitamins along with the program. And we're doing this to maintain your lean muscle mass so your metabolism stays high. And we're making sure that we're giving you a good, adequate protein. So how does this work? How do you maintain your energy while you're on this program and burning fat? Well, think about it this way. If the average person is losing 2.5 pounds of fat per week, that works out to about 10,000 kilocalories. If you divide that by 7 days for that week, you're getting about 1,400 extra kilocalories per day. And on the program, you're eating somewhere between 850 to 1,000 calories. So you are getting somewhere between 2,400 calories a day. So you have good energy because you're getting the energy from the fat. So once you're in what we call a state of ketosis, you should feel good, you shouldn't be hungry, and you should be able to maintain it for a long period of time until you lose all the weight that you want to lose. So this is a 4-phase program. In the first phase, you lose all the weight that you want to lose. The second phase, we add back an extra meal. And in the third phase, we restart the pancreas by giving you carbs in the morning so that your body gets used to having the insulin stimulated again. And phase 4 is just getting back to life and knowing how to eat properly. And we show you how to maintain this. The great thing I find with this program with my patients is that they're really able to maintain the weight loss. So why do we use protein? Because protein is vital to every organ in the body. Protein is vitality, so we need protein. And why do we use vegetarian proteins versus animal proteins? It's simple, because the vegetarian proteins, we absorb about 95% of that protein, whereas in animal protein, we're only absorbing up to 70%. So think about it this way. With a 5-ounce piece of filet mignon, you're getting 35 grams of protein, but you're really only absorbing 24 grams of it. In one of our drinks, for example, it has 20 grams of protein, but you're absorbing 19 grams of that. So that drink is almost the equivalent of having like a 4-ounce piece of steak. So think about that when you're having your protein drink, that it is a really substantial amount of protein. So as we're finishing up here, just remember that this program has 2 contracts. One is to lose the weight, and one is to keep the weight off. We really want dieters on this program who really want to keep the weight off for life, and we want to teach you how to do that and support you through this process.